Ever wondered why, despite maintaining good hygiene, you or someone you know still battles with body odor? It's a common issue that most people have faced at some point, but the science behind it is not as commonly understood. Body odor, scientifically known as bromhidrosis, is a normal part of the human experience. It's primarily a result of the interaction between sweat and bacteria on our skin. But before we dive deeper, it's important to understand that not all sweat is created equal. In fact, there are two types of sweat glands in our bodies: eccrine and apocrine glands. Eccrine glands cover most of our body and produce a clear, odorless sweat, while apocrine glands, located in areas like our armpits and groin, produce a thicker sweat that, when broken down by bacteria, can cause body odor. Now, you might be wondering, what are the symptoms of body odor? Well, it's not always as straightforward as one might think. The most obvious sign is an unpleasant smell, but other indicators can include excessive sweating, or even an unusually sweet or fruity smell, which can sometimes signal an underlying health issue. The effects of body odor extend beyond the physical. It can also impact one's mental and emotional well-being, leading to low self-esteem, social anxiety, or embarrassment. In some cases, it can even cause social isolation. But fear not, body odor is not a life sentence. There are several ways to manage and prevent it. The most effective method is maintaining good personal hygiene. Regular bathing, especially with antibacterial soap, can help reduce the bacteria on your skin, thereby reducing the chance of body odor. Wearing clean, breathable clothes and using antiperspirants or deodorants can also help. Diet too plays a significant role in body odor. Consuming certain foods like garlic, onions, and spicy foods can increase your body's odor. Drinking plenty of water and eating a balanced diet can also help manage body odor. If body odor persists despite these efforts, it might be time to consult a healthcare professional. Persistent body odor can sometimes be a sign of an underlying health condition, like hyperhidrosis, diabetes, or even liver or kidney disease. In conclusion, body odor is a natural part of being human. It's caused by the interaction between sweat and bacteria on the skin. While it can have negative effects on a person's self-esteem and social interactions, there are effective ways to manage and prevent it. Good hygiene, a balanced diet, and the use of antiperspirants or deodorants can help. But remember, if body odor persists, it's always best to seek professional medical advice. And there you have it, the ins and outs of body odor. It's a common issue, but with the right knowledge and tools, it's one that can be effectively managed. So the next time you find yourself or someone else dealing with body odor, remember, it's not about masking the odor, but understanding and addressing its root cause.
I believe this video's content was helpful to you, so please kindly hit the like button, then share with your friends to benefit from this knowledge. Also do well to subscribe in order to get further health-related information from this channel. Thank you.